Chapter 46, Alterations in Special Senses. So we'll look at some disorders today of inner ear, vision, and so on. So we'll start with vertigo. This is typically a vestibular disorder, which is an exaggerated sense of motion. So you feel like you're dizzy, and accompanying symptoms are things like nausea, vomiting, pallor, sweating, and nystagmus. Okay, nystagmus is involuntary eye movement. Some causes for vertigo can be peripheral, side effect of medications, and central nervous system issues such as some form of brain damage or brain injury, brain stem, and cerebellum. Stress, inner ear infection, vestibular cause such as cranial nerve 8, also known as the vestibular cochlear nerve, Meniere's disease, calcium buildup. Okay, so too much calcium building up in the inner ear, loose crystals from the semicircular canals. And then aberrant, afferent, efferent communication. Okay, let's do a reminder of afferent, efferent. All right, so there's the brain and the body. So the body communicates to the brain through afferent or sensory, and the brain will then communicate to the body through an efferent or motor response. And aberrant here means like abnormal, or there's something that is messing neurologically with the nerves, whether it's peripheral nerves or the central nervous system, but that can cause abnormal afferent-efferent communication that can contribute to someone's vertigo. Okay, hearing impairment. The external ear, so that's the pinna and the auricle itself, including part of the ear canal. There can be a foreign object that is stuck in the ear that can decrease hearing, such as increased wax buildup, food, etc., or anything that can go into the ear. You see this in kids, they can pick up pretty much anything and either shove it in their mouth or shove it in their ear. Your clue is people that are constantly asking you to repeat yourself, even if you're speaking clearly. And the other clue is they will stick their good ear towards you. Sometimes they'll even put their hand behind their ear to try to enhance the sound. So those are some clues. There's a hearing impairment. And for kids, depending on how young they are, they won't always give you verbal clues like, hey, I can't hear you. They just ignore you, or what you perceive as ignoring, and maybe it's because of a hearing impairment. Okay, the middle ear could be because of increased fluid. Okay, that is called effusion. Otitis media, tumors, trauma, otosclerosis, and this can happen. An example of how we would get otosclerosis is a side effect of medications such as your quinine and antibiotics, such as aminoglycides, okay, aminoglycosides. An example of that is gentamicin. Okay, quinine is for it's anti-parasite. Okay, and also these should either not be given or extreme caution during pregnancy. Okay, for chances of otosclerosis. Okay, conductive loss. This is where sound cannot reach the cochlea. Okay, cochlea is that part of the inner ear that looks like the snail body. And inside of that is the organ of Corti, so that's a very powerful structural and functional unit of the ear to help us with hearing. Okay, so if sound cannot reach the cochlea, it could be due to canal obstruction, okay, such as a foreign body, mass loading, or effusion, and otosclerosis. Okay, this is where the ear bones, your 3 ear bones, harden. Okay, that's the sclerosis part. And when this happens, you're going to lose vibration. Okay, as sound waves enter into the ear, they irritate the tympanic membrane, eventually vibrate your 3 ear bones, the malleus, the incus, and the stapes, and then those sound waves then go through the oval window and into the cochlea, and eventually into the organ of Corti. Okay, the inner ear Reasons for some hearing loss can be sensory neural. Okay, so that's the cochlea itself. Cranial nerve 8, also known as vestibulocochlear nerve, the organ of Corti. Okay, Meniere's disease. Okay, named after the person that founded this, is endolymph damage. Okay, from trauma, vascular changes, and ischemia. Okay, signs and symptoms of Meniere's. Would be vertigo plus tinnitus plus nystagmus. Okay, the tinnitus is the ringing in the ears. And if a person has these three things, then the diagnosis is usually Meniere's disease. Okay, also, sounds that are greater than about 85 decibels. So dB for short. Sounds greater than 85 decibels are considered harmful to the ear. Okay, here is a reference or an example. A lawnmower, traditional gas lawnmower, can be around 90 decibels. Okay, a lot of arenas, like where you would see a concert or a hockey game or a basketball game, can get 100 decibels plus. Firearms can be about 120 decimals and higher, depending on the caliber. So that just gives you an idea of a reference for sound waves that can be harmful to the ear. Okay, the most common way people hurt their ears through sound wave are the ear pods or some form of headphones. And it's a relative number. So obviously, if you have this ear pod in your ear, the person across the street is not going to hear you at 90 decibels, okay? So it's not that kind of speaker system. However, because it is confined in the ear and it's going to concentrate the sound waves into the ear, and this is a very common way people actually hurt their hearing. In fact, it got to the point where legislation kicked in and they started to work with these companies like your Google phones, your Apple phones, your Android phones, and they started to put in these safety mechanisms for volume. So if you turn up your volume enough, your bar or volume meter will turn red or orange. Depends on the brand. But it gives you a warning that basically says, if you keep turning this up, you can damage your hearing. Okay. And roughly that's around 85 decibels. Okay, so if you can help it, try to keep your ear pods and headphones uh, certainly below those warning signs, but go as easy as you can as possible to protect your hearing. Okay, otitis media. There is acute and there is chronic. Okay, acute is a sudden onset of pain within the ear. Okay, it may follow an upper respiratory tract infection. Okay, you can do a visual exam with your otoscope. So look in the ear, and you're simply looking for a red tympanic membrane. Okay, that's the fancy word for the eardrum. Okay, otorrhea is where the tympanic membrane ruptures. And then some fluid can leak out. Okay. All right, one of the reasons why infants and young kids are more susceptible to ear aches and ear infections and other ear problems is because their eustachian tube is more um, to the horizon, so it's more left and right. And as you grow into your adult body, it becomes more oblique. And also with infants and newborns, it is common to end up feeding them with the baby horizontal. Okay, you do not want that child to be in a horizontal position. You want them to be more diagonal or oblique or more upright. That's because the fluid, if they're horizontal, can uh, go into that eustachian tube and starts to clog it up and start to cause some problems. Okay, so that gets into some feeding techniques, whether you're breastfeeding or bottle feeding. And then as you age, the eustachian tube becomes more oblique, and oftentimes, if there's chronic reoccurring ear infections for the kids, they literally grow out of them once they get into their adult body because now the ear tubes or the eustachian tube can drain properly. So with my patients, we talk about that with the orientation of the child or the infant and feeding. And then there is also some um, manipulations that you can do to clear out the eustachian tube if it has collapsed. Okay, so then once it collapses, then this pressure builds up and it hurts because one of the functions of the eustachian tube is to help equalize pressure. And there are some uh, manual techniques to help reestablish the equalization of pressure. And and then promote healthy drainage. And then we get into the feeding techniques and all that stuff. Very successful at reducing or even completely getting rid of these ear infections in kids. Okay, now adults can still get them, and sometimes their eustachian tube doesn't equalize pressure or drain properly as well. And same, there's some manipulations you can do to help open up that eustachian tube and reestablish pressure changes and drainage. Okay, visual impairment can happen at any age, at any time. Clues for visual impairment would include squinting, closing one eye, okay, to look at something. Sometimes people do that on purpose and they keep moving the page or the object back and forth until it comes into focus. Eye rubbing, and then complaints of blurred vision, floaters. Okay, sometimes people will literally see these floaters in the eyes, and headaches. Okay, visual disturbances can cause headaches. All right, in this diagram here, we're seeing normal vision. So whatever object we're looking at, okay, you do want it to accurately land on the posterior aspect of the retina. Okay, you'll notice that the light is coming to a focal point and accurately landing on the posterior aspect of the retina. Okay, the lens is going to bulge or relax depending on if you're farsighted or nearsighted. And what that does is it helps bend the light appropriately so that it lands accurately on the retina. Okay, so myopia, all right, so this is a nearsighted person or myopia, and which means they can see near but not far. Okay, they can see near but not far. And you'll notice that they're looking at this object and it is landing too far in front of the retina. Okay, so then what you do, and this is where eye doctors come in, is they put different concave lenses in front of you're looking through the concave lenses, and they keep switching the strength of those lenses until the object is not blurry anymore. Okay, so this is how you come up with your prescription. On the hyperopia part, this is farsighted, which means the person can see far away but not near. Okay, not nearsighted. And then what happens when they are focusing on an object, it lands too far posterior on the lens, and then they're given a convex corrective lens, okay, because then it will bend the light appropriately to land it accurately on the posterior aspect of the retina. Okay, presbyopia, this is where reading becomes blurry. The presby part means old, and opia means the eye. So it literally translates to old eye. So typically as people age, vision becomes blurry. That's why they say, it's age related. I think that a lot of that has to do with nutritional deficiencies over time. For example, vitamin A deficiency that feeds the retina Also, inactivity, so not being active or being sedentary, which means poor circulation, and some other diet and lifestyle factors can contribute to the blurriness. Okay, strabismus is an ocular misalignment where the prefix here, the strebi part, is Greek for squinting, or to squint. And then there's different names, different conditions. Okay, the first one we'll start with is the esotropia. Okay, eso means inward, and opia is Greek for the eye. So literally means a turning in of the eye, so going toward the midline or toward the nose. Okay, in this particular diagram, everything here on this person's left eye is normal, and on the right side here they're showing the abnormalities. Okay, so just for simplicity reasons, they're just focusing on the right side here. Okay, the next one is exotropia, and exo translates to the outside, and opia means eye. So the eye is moving laterally or has moved to the outside. Hypertropia. So hyper means above or too much of is another translation, but in this case means above. So the eye is looking up. And then hypo, which means below. So the eye is looking down, so hypotropia. All right, these are different conditions under strabismus. It could be something wrong with the cranial nerves, and that goes back to the LR6SO4R3, where the lateral rectus muscle is innervated by cranial nerve 6, the superior oblique muscle is innervated by cranial nerve 4, and all the rest of the eye muscles are innervated by cranial nerve 3. So there could be a cranial nerve issue, could also be a muscle issue. All right, something's wrong with the muscle, either congenitally it's too long or too short, or something else is going on causing this. Okay, cataracts is clouding of the lens. This leads to blurred vision. Okay, some causes are aging, also known as senile, trauma, like the lens rupturing would be an example. Diabetes, and that is under the umbrella of metabolic disease. Hypoparathyroidism, okay, hypoparathyroidism also would be considered under metabolic disease. Okay, smoking, and or alcoholism, and then chronic steroid use. And in this case of steroids, it's the anti-inflammatory steroids like prednisone, for example. Okay, treatment is surgery, and they can do a lens replacement. Okay, retinopathy. This is a disorder of the retina. Okay, so that's the structure in the back of the eye. And an example could be detachment, diabetic, or degenerative. Okay, detachment can be spontaneous or from trauma. And the spontaneous is weird. It literally just detaches for no reason. People just be sitting there on their computer and the retina just detaches. Okay, some risk factors is hypertension, inflammation, infections, decrease in vitreous humor, circulation. Okay, so a reminder of the fluid in the eye. The fluid in front of the lens is called the aqueous humor, and the fluid behind the lens is called the vitreous humor. And humor is a fancy word for fluid inside the body. Okay, the fluid issue causes a traction, almost like a suction traction, and then that can lead to a progressive detachment. Okay, with diabetic, there is proliferative, and non-proliferative. Okay, proliferative is new, abnormal blood vessels form, and then they leak, and then they create damage to the eye. So this decreases oxygen, decreases nutrition to the eye, and can cause retinopathies. Non-proliferative is microaneurysms, in the blood vessels of the eye. And degenerative is a decrease in vitamin A. And vitamin A feeds the photoreceptors. Okay, and the photoreceptors are nerves. So vitamin A helps feed the nerves, and it causes the nerves to die. And so it causes a rhodopsin, mutation. And this is a protein that is responsible for the photopigment, also known as the visual pigment of the rods. Okay, vitamin A is in the fat-soluble family, so that's vitamin A, D, E, and K. A lot of people do have a problem absorbing their fat-soluble vitamins. The most famous of them being vitamin D. Okay, here are some pictures. So one of the best ways to know your abnormals is to know your normals. Okay, so right here we are looking at a normal, and there's the optic disc. That's where cranial nerve 2 comes in. And you can also see the blood vessels, okay, all that red stuff there, coming in to the eye. Okay, we have the macula and foveus centralis area. The whole thing, the back of the eye is the retina. Okay, so this is a normal. If you look in someone's eye with a fundoscope, or you would, and this is normally what eye doctors have, and or your general practitioner. So when you look in the back of the eye, this is what you see. I've got a Welsh Allen fundoscope in my office, and the ability to be able to look at somebody's blood vessels is amazing, because we really can't see blood vessels uh, except for the eye, unless you have like fancy imaging and all that stuff. Just simply being able to take a look at someone's eye and looking at the nature of their blood vessels is fabulous. And it reveals a lot of information about the overall health of the person. Okay, on your reading right here, you're seeing a diabetic retina, and you're seeing things like here's a hemorrhage. Okay, so some bleeding. There's an aneurysm. Okay, so we've got a bunch of hemorrhages, bleeding kind of everywhere. Several aneurysms going on. Okay, these are exudates. The yellow is exudates. Okay, we're also seeing cotton wool spots. So an unhealthy eye. Okay, the cotton wool is a side effect of reduced blood flow, which is ischemia. Pretty classic of a diabetic or a person with hypertension, especially chronic hypertension. The high blood sugar damages the small blood vessels, so the microcirculation in the retina, leading to reduced blood flow and the formation of those cotton wool spots. In other cases, it could be an immune or inflammatory response, like from HIV or Rocky Mountain spotted fever. Anemia can be a side effect, clotting disorders. Okay, the aneurysms of the retina is that ballooning of the blood vessel, okay, that you're seeing there. And they can leak blood and fluid, contributing to, more macular edema building up in the eye. Main cause is hypertension, and the blood vessels weaken over time, causing that ballooning. Okay, here is a picture of a detached retina. All right, you can see that very cloudy area. So that is evidence of a detached retina. Okay, age-related macular degeneration is the leading cause of blindness in older adults. Degeneration to the retinal pigment, likely because of inflammation and cytokines. So these inflammatory components of your immune system that comes in. Considered idiopathic. Other authors that I agree with, I tend to favor this side, is nutritional deficiencies over time, poor circulation, and other pro-inflammatory things that are happening to the person would cause this. Okay, there's dry macular degeneration. So this means the macula is degenerating and there's no bleeding. And then there's wet macular degeneration, which means the macula is degenerating with bleeding. All right, glaucoma is progressive loss of vision due to increased ocular pressure. Okay, so this causes a decrease in blood flow over time. Okay, there's two types of glaucoma. There is chronic open angle, and there is acute closed angle. Okay, the chronic open angle is, because it's chronic, this is a gradual increase in interocular pressure over time. Okay, so there's no symptoms at first. And then gradual loss of peripheral vision. Okay, so you can see here on this side, I'll circle that in black ink. Okay, so on your reading left here, this is the description of an open angle, or the chronic open angle. And the angle that they're measuring is right here. Let me do that in, let's try purple. Okay, so there's the angle, and then we're going to compare that to the other side, where the angle is, the acute closed angle, which basically the angle is gone. Okay. So what this does is it pushes the lens posterior. So as the lens keeps moving backwards in the eye, it is going to change the person's peripheral vision. So they start to lose their peripheral vision. Okay, it's likely this fluid, the aqueous fluid, too much of it, so it's not draining out of what's called the canal of Schlemm, and it keeps building up, and it's pushing the eye posterior. In acute closed angle, so there is an abnormal angle between the pupil and the lateral cornea. Okay, the angle is narrow and blocks the aqueous humor. Okay, so the fluid builds up. So it's acute, so signs and symptoms is severe pain in the eye with blurred vision. And the lens is pushed forward. Okay, next is the different types of blindness that can happen. Okay, first let's do a quick neuro review. Okay, so here's the brain. Okay, here's the eye. And then we have the optic nerve, okay, on both sides. And the optic nerve does eventually intersect and become the optic chiasm. And then from the chiasm on backwards, you have the optic radiation. And that will then connect, the nerves will connect itself into the occipital lobe, which is the primary visual cortex. Okay, from the eye to the brainstem area, those nerves are going to embed itself into the lateral genticulate nucleus. Okay, you'll also notice that the eyes have ipsilateral neurological innervation. Okay, so when we look at the left eye here and the right eye, the red is ipsilateral. These red wires are ipsilateral, so that means on the same side of. And then the teal color is contralateral, so the nerves from the right eye then cross over to the opposite side, so that's contralateral. And then the left eye does the same thing. There are ipsilateral neurological wiring, and then there's contralateral ipsilateral wiring. Now, as a result, this gives us different visual fields. So up here, they show you in the red and the teal what is responsible for what as far as the visual field neurologically. Okay, so if everything's working, you have essentially this panoramic view, so you can almost see completely to your left side and almost completely to your right side. So if you're looking straight ahead, your peripheral vision should be pretty good. And that's what this is trying to show here. And if you focus on just the left eye, then this is what you can see. This is your visual field. And if you look at just the right eye, then this is your visual field. And then they break that down into, looking at the right eye, your temporal side and the nasal side. Okay, so there's another way of looking at that would be your lateral vision. Okay, so being able to see to the lateral side or temporal, and then being able to see to the medial side or nasal. The left eye has the same thing. It has the temporal part operated by the teal nerves, which happen to be the ipsilateral nerves, or excuse me, the nasal side are operated by the red nerves, and the teal is the nasal side. Okay, so that's the neurological innervation. All right, so once you know the wiring, then you can understand what happens with the different kinds of blindness. For example, in our first example here, if the entire optic nerve was severed or damaged, you are hurting both the ipsi and the contralateral wiring. So the entire visual field is going to be damaged, which means you'll have complete blindness in the right eye in this example. Okay, so total right eye vision loss, but the left eye will be spared. Okay, in example number 2, this is where the optic chiasm is damaged, and that part only hurts the nerves that cross over. So your contralateral nerves from the right eye and the left eye are compromised, and those nerves operate the temporal visual field. So going back up here, it operates the temporal visual field. And so if that happens, then you have bitemporal hemianopia. Okay, so hemi is like half of, if you will, like the hemisphere is half of a sphere. So bilateral, so both sides, the temporal vision part is, you can't see that, but you can see the nasal part. Okay, so the nasal part is spared. Okay, in example number 3, the left ipsilateral nerve is damaged. Okay, the left ipsilateral nerve, and that nerve operates the nasal field. Okay, the left nasal field. So the left nasal field will be, you can't see, so that's why they have it blacked out there. So left nasal hemianopia. All right, so hemi is half. So in this case, it's the nasal side. All right, in example 4, both the ipsilateral on the left side and the contralateral on the right side is damaged. Okay, so the left ipsilateral wiring functions nasal, and the right contralateral functions temporal. Okay, so this person cannot see on the left nasal, nor can they see on the right temporal. So right homo namias hemianopnia. Now, homo means same, so we are looking at the same side. okay, for lack of a better term, the right side of both visual fields. And then in example 5, we have the optic radiation. This one happens to be on the right side, so the right optic radiation is damaged. And as a result, um, the this area on the occipital lobe functions the um, ipsilateral from the right side and the contralateral from the left side. So we're going to have left homoomnios hemianopnia with macular sparing. Okay, so homo means same. In this particular case, it is on the left side of the person's visual field. All right, so those are some examples of different blindness depending on what part of the nerve tract from eyeball all the way back to the occipital lobe is damaged. Okay, so it's possible for a person, when they hear someone's blind, you just think, well, they're 100% blind. So that's not always the case. So sometimes people are blind, it's only partial. Okay, so blindness doesn't mean 100% you can't see anything. There are different levels of blindness. Okay, loss of smell and taste. So infections, illness, and inflammation, especially in the sinus area, so the nose and throat, can cause you to have decrease or loss of smell and taste. Excessive exposure to chemicals such as paint and cleaning supplies. People that work in factories that have a pretty high chemical smell can burn out those sensory nerves, and you can have a diminished or lost sense of smell and or taste. And then there's trauma and shearing force to the ethmoid bone and cribriform plate. So that if is in the superior nose area, that cribriform plate, and the olfactory nerve, which is cranial nerve 1, the olfactory nerve, those nerves which come off of the brainstem area, they go anterior, and then there's some nerve wires that dive into the nasal area, but they have to pass through that cribriform plate, which is part of the ethmoid bone, to do that.